This PetX Talk is brought to you by Natura Pets, Found Animals, and Dogwise Publishing.
Hi, I'm Dr. Patrick Mahaney. I'm a Los Angeles-based veterinarian, and I've been in practice since 1999. I'm here today to talk to you about the different types of veterinary medicine. A lot of owners don't realize that there are different types of veterinary medicine, and they all can take a different perspective to pet health. We've got conventional veterinary medicine, which is often perceived or considered to be Western veterinary medicine. And that's what you'd probably go to your typical vet's office for a physical examination, for blood testing, urine testing, fecal testing, maybe surgery or x-rays. And that's all incredibly important because that's really the basis for what veterinary medicine is today. Most owners take their pets to the vet on a regular basis, hopefully for annual or more frequent wellness exams, or when the pet gets sick or has some kind of trauma. So when you're going to the vet for those wellness exams and diagnostics, you're getting a variety of services done. And that's the great thing about veterinary medicine is that there's so much to offer today. If your pet isn't well, a diagnosis can be made and a medication can be prescribed. Or maybe there's something that's more concerning like a fracture or some kind of skin mass that needs to be cut off surgically and sent to the laboratory for biopsy. That's all a crucial part of veterinary medicine. But a lot of times we start to forget about what's the foundation of health in general. What about lifestyle? What about food and supplements to complement whatever treatments are being done by conventional veterinary approach? So that's where the integration of other veterinary perspectives comes in. So integrative veterinary medicine actually combines multiple modalities to hopefully best serve the pet's individual needs. Integrative means that we're going to combine something else with Western, such as Chinese medicine. That's actually what I practice in conjunction with Western veterinary medicine is traditional Chinese veterinary medicine. So I actually integrate both perspectives every time I'm examining and treating my patients. So Chinese medicine has been around for way longer than Western medicine, and so we have to really think about the importance of the fact that it's been around for thousands of years, whereas Western or conventional veterinary medicine has only been around for maybe 100 years or less. And Western medicine really grew out of an extension of human medicine, but they can complement each other in a lot of different ways. So as a Chinese medicine practitioner, I use traditional Chinese veterinary medicine, or TCVM, and that actually takes a different perspective to pet illness and pet health. There actually are many different theories that go with Chinese medicine, coming down to a basic new number of theories called the 8 principle theory. And that's something that incorporates yin versus yang. So yin is kind of cooling and moisturizing and feminine and soothing, and yang is energizing and masculine and uplifting and heating. And then we've got excess and deficiency. We've got interior and exterior. And so all those things really play into how we take a look at pet health. So say I'm a Western practitioner and I'm doing a conventional physical exam. I'm looking at my patient's eyes and ears and nose and throat and listening to heart and lungs and palpating the abdomen and taking every limb through range of motion, touching all body parts, and absolutely doing a rectal exam. That's a very important part of the Western exam too that a lot of owners kind of forget about or don't want to do, but it's crucial that the vet knows what's going on right inside the dog or cat's bum. But in a traditional Chinese veterinary medicine exam, I'm still thinking about those things, but I'm also looking at the color and appearance of the tongue. Is there some kind of like funky film that's on the tongue surface? Is there a smell that the pet exhibits from their nose or from their mouth or from their ears or from their body? When I feel my patient's pulses, I'm thinking about it differently. I'm not just feeling for a strong or weak pulse or how quickly the heart is pumping. I'm feeling for, is it a pulse that's pushing my fingers away from the surface, or do I have to really push my fingers deeply in to feel the pulse? Or is it kind of bouncing off of the surface of my finger? So Chinese medicine physical exam does incorporate a lot of the same aspects of the Western exam, but it looks a little differently. And a lot of Chinese medicine veterinarians and also holistic veterinarians who fall into the category of integrative really think about the patient's whole body health, and that's incredibly crucial. When you go to the vet, a lot of times you just have 20, 30 minutes tops inside that office to talk about all your pet's problems, and sometimes we forget about the things that can happen in the household that could sicken or injure our pets. Especially when we're getting into like an adult and senior pet age, we have to really think about modifying the pet's household and lifestyle so that we're not creating illness or injury. There's so many things that happen in the home that actually really are very traumatic to pets. jumping down off of high beds, jumping up or down off of, walking up and down stairs, getting in and out of a litter box, going in and outside to eliminate waste material, having a poop and pee, of course. All those things can potentially be harmful to a pet, and so we have to always think about what's going to be the safest and healthiest for the pet. And that's where the integrative approach really comes in, because we're able to talk to our owners and really ask them very key questions as to what is our pet doing. Is he comfortably squatting to urinate and defecate? Is he going outside and eating things that he shouldn't? Soil, feces, dirt. What exactly is the pet eating? Not just are they eating well or are they not eating so well, but are they eating a fresh, moist human-grade food, or are they eating a processed kibble? Is something in the food or treats contributing to the pet's digestive tract problems? That's actually one of the most common reasons that pets come to the veterinarian, is because they're having vomiting or diarrhea. A lot of pet owners don't realize that they're directly contributing to that by giving too much or too little food, by feeding unusual foods, which could be foods from the table, which aren't necessarily bad. Table foods are just foods that exist naturally in nature that maybe not be appropriate for the pet at that time. Are they feeding processed treats that look like fake bacon that are made with all sorts of feed-grade ingredients, including chemical preservatives and toxins and substances you would never eat yourself? So those are some of the things that the integrative and holistic vet think of. So we always want to think about really using all our different perspectives together, but sometimes it takes going to that special veterinarian that is going to take the time to talk to you about the pet's health problems, not just from what they see in front of them, but from what's going on at home. So if you're seeking care from a traditional Western veterinarian and your pet's problems aren't really being met, you might want to seek out that Chinese medicine practitioner or a holistic veterinarian. And one may not be readily apparent in front of you. You might have to search for it. You might have to ask a friend or family member. You might have to ask your veterinarian for a different perspective, and he would refer you to somebody that he knows who does Chinese medicine or is considered to be a holistic veterinarian. Or you could search. I'm a member of the American Holistic Veterinary Medical Association, which is the AHVMA. And there's a really informative website, ahvma.org, where you, the pet owner, could find a holistic vet in your area. So you could then hopefully work in collaboration with the vet you're currently using, but maybe take a different perspective. Really focus on food, supplements, lifestyle modification, daily activity to try to make your pet healthier so that less medication is needed. And that's actually where one of the great things that come out of holistic or Chinese medicine perspectives really works well with conventional veterinary medicine, is that we should always be thinking about how can we reduce our pets' needs to take medication. Because medication works for some pets, medications are important, but sometimes they can cause side effects. For example, an old arthritic dog or cat might need the benefits of a non-steroidal anti-inflammatory drug, also known as an NSAID, kind of like we would take aspirin or ibuprofen, or I take piroxicam for my own arthritis. But I want to minimize my need to take those medications because there are potentially side effects. There can be digestive tract issues, kidney and liver problems, even blood clotting problems from taking these medications. So if your old dog with arthritis, maybe your dog has hip dysplasia and arthritis has developed over the years, is needing twice a day anti-inflammatory medication just to stay comfortable and mobile, you really need to start thinking about the integrative approach so that less medication can be used. Because perhaps medication is working right now, but over time it could potentially cause a problem. And that's where we're seeking out that perspective of the holistic vet or the Chinese medicine vet so that we could think about supplements to try to reduce the need to take those medications. Oral glucosamine, chondroitin, MSM, antioxidant supplements can help to make the joints healthier so that less medication is needed. Fish oil-based omega-3 fatty acids can have a natural anti-inflammatory effect so that less medication is needed. All those work really well together. And then maybe that Chinese medicine vet could incorporate something like acupuncture. You could maybe go to have physical rehabilitation done where your pet could swim in a underwater treadmill or even in a pool to keep the joints loose and mobile, and maybe even drop a couple pounds so that there's less stress on the body. So really, any point in a pet's life, you can start to incorporate multiple modalities. It's very crucial, especially as we're thinking of older pets, those dogs and cats that are older than 7 or those that are senior pets, that we really think about this complementary and alternative type approach. Along the lines also of trying to reduce inflammation and stress in your pet's body, just because you get a card in the mail that says that your pet needs to have a vaccination booster doesn't mean that it's the healthiest and most appropriate choice for your pet. For my own pet and for my patients, I always suggest doing vaccine antibody titers as a potential alternative to giving a booster vaccine, because you just never really know when something could happen from that vaccine. Vaccines are really important. I'm not anti-vaccine, but sometimes the immunity to a certain infectious agent carries on for much longer than the recommended booster interval. So while your kitten or puppy gets distemper, parvo, panleukopenia, rhinotracheitis vaccinations, as he or she gets older, you could think about testing the blood to see what's the current level of antibodies. And if that antibody level is at a protective threshold, then you might want to think about waiting a year and deciding should we retest again before just giving a booster. Especially when dogs or cats get multiple vaccinations in one setting, there's an increased likelihood of vaccine-associated adverse events. And unfortunately, after you give that vaccine, you can't just take it back. So if you think about what's really healthier for the body, giving one vaccination at a time, making sure your pet is absolutely 100% healthy and that all diseases are resolved. Like even periodontal disease puts a lot of stress on the body, so that could be affecting your pet's immune system so that he or she doesn't produce an appropriate vaccine response. So small dogs and cats, sick and senior pets, we want to think about only vaccinating one at a time, and definitely thinking about complementary and alternative perspectives like antibody titers instead of just giving that booster vaccine. Because the immunity is a complex process, and you don't want to start to go down the route of having to deal with immune-mediated disease or cancer, and those make just giving your pet a conventional type preventative treatment like a vaccine that much more problematic. So at any point in your puppy or kitten's life, you can think about this complementary alternative approach. We want to use our Western perspectives, our surgery, our medications, our diagnostics, but consider also the other perspective where we've got lifestyle, nutraceuticals, which are supplements, healthy human-grade foods, all striving to try to reduce the need for medications that can potentially have side effects. So that's my perspective on Western medicine, integrative medicine, and Chinese medicine or complementary and alternative veterinary medicine for you today.
We're here with Dr. Patrick Mahaney after his wonderful PetX talk. Dr. Mahaney, I want to ask you a question that I think most people have, which is, how do I know which approach is right for me and which approach is right for my pet?
Sure. That's a really good question, and an important one that pet owners really should consider from the get-go when they're getting a pet, be it a young puppy or kitten or an adult dog from a rescue or somebody that just kind of ends up in their family because another family member has passed on or had to move or give up a pet. And so you could really take on a pet at any point during the pet's life, and you have to think about tailoring the health approach and lifestyle approach very specifically to that pet's needs. So you might go to the vet because you just got this dog, it needs to have a wellness examination, you have no idea about its vaccination history or deworming or parasite prevention history. What do? It's kind of like a shell. You just have to figure out how to get into that shell and figure out what is healthy and what is not. So that's where the conventional approach is a really good approach, the Western approach. Start out with a physical exam, figure out what the pet's current baseline of health or sickness is, see if there are diagnostic tests that need to be done, and then what are going to be the treatment recommendations based off of that. So that way we kind of have a little bit of a plan set out, but then what if that plan doesn't seem right to you intuitively, or the plan involves giving 10 different medications at 8 different times of the day, so it just affects your lifestyle and your ability to provide for the pet properly. So we always want to think about trying to make sure that we're using the approach that best works for the pet's health, and then also is something that you can maintain. What if the cost of the medications is so high that you're not able to continue to provide the care? What's kind of the second level of care that you could provide? Or is there something that you could do at home from a changing of the diet perspective that's going to make your pet's intestines healthier so that he can tolerate medications better? So really any pet's health can be tailored with the approach of a complementary and alternative approach, which includes the integrative approach, which might include Chinese medicine, or conventional Western practice. So there's so many options available for pets these days. It might take some trial and error, What I really would highly focus on, though, is, and this is really how I feel like I work best with my clients, is that I get to know them really well. I go to their homes. I see what's going on in the household, inside the house, outside the house. I see the housekeeper like giving that fake bacon treat to the dog on the side when the owner has no idea what's going on. So really having an open dialogue with your veterinarian, establishing a level of trust where you can respect their perspective and they know how to guide you appropriately, that's really crucial. I mean, I want to trust my human doctor and feel like he is looking out for my best interest. The veterinarian should do the same thing. And being a vet is really just like being a pediatrician, because you have the pet owner telling you about what they're seeing, and then you have to integrate that with the perspective that you're getting from listening to the pet owner and your physical exam and diagnostics. So the trust relationship and the ongoing open communication is crucially important, and that really crosses all perspectives of traditional or Western veterinary medicine, integrative veterinary medicine, and also complementary and alternative, which includes Chinese medicine.
The approaches are different, so does that mean the outcomes will be different?
Well, that's another great question. Hopefully the outcome is that the pet is healthier and the pet has a better quality of life. Or if ultimately the pet is too advanced in disease or trauma or sometimes age, we really focus on the quality of life and we ultimately let the pet go humanely and peacefully. I don't recommend just letting a pet die naturally at home. There really is no dying of natural causes. Something is shutting down, multiple systems fail, the pet expires. That is a very unpleasant process that too many people go through. Too many pets may go through if the owner feels like I just want them to die naturally. It's really crucial that we focus on quality of life and humane euthanasia. So back to your question with what is the approach and is the outcome going to be the same? The outcome might be better if we take the integration of multiple perspectives, because maybe just medication, surgery, radiation, chemotherapy isn't right for the cancer patient. I work with a lot of cancer patients and I've noted so much they do better with their outcomes and the owner is happier and the quality of life seems better if we're also focusing on trying to eliminate the side effects as much as possible, especially with chemotherapy. It's often days later that we're seeing digestive tract side effects, bone marrow suppression, and that could include reduction in numbers of red and white blood cells and platelets, which makes your pet immunocompromised, or maybe they don't clot their blood properly. So especially dogs and cats undergoing chemotherapy, if we focus on human-grade whole food diets that look very similar to how they appear in nature, not necessarily raw meat diets, because those can potentially have pathogenic bacteria that could affect the pet's health negatively, or pathogenic bacteria could go to other household members, but cooked whole food diets along with supplements that help to maintain normal digestive tract function, the outcome tends to be better. The chemotherapy is better tolerated. The pet feels better. The owner isn't having to get up at 3 in the morning to let the dog out to have explosive diarrhea. So if we can focus on maintaining normalcy, and that's really going to create the best outcome, and that's where using multiple perspectives together, I feel, works best.
Well, thank you so much. We really appreciate everything that you're doing in the pet world. It makes a difference.
Thank you.
Funding for PetX Talks is provided by Natura Pets. Natura Pets can help you optimize your pet's health with premium organic supplements from the Amazon and Andes Mountains. Visit naturapets.com. Dogwise Publishing. All things dog. For all of your expert dog book needs, visit dogwise.com. Found Animals. Working towards big ideas that advance the safety and happiness of animals in our homes, our shelters, and everywhere in between. Visit foundanimals.org. This has been a Pet World Media Group production.